So welcome to our next edition of Small Talk Big Issues. We have the great pleasure today to have with us Sherry Pruitt. Dr. Sherry Pruitt is a behavioral scientist. She has a PhD in clinical psychology and over 30 years of experience solving problems in healthcare, helping patients. She's an academically trained scientist clinician and currently works as an independent consultant, helping her patients use evidence-based approaches, very dear to us at Observia, to help out. Her first digital behavioral change program was created in 2007, years before anybody else was talking about digital health. So we have a real pioneer with us today in digital health. So Sherry, welcome. Welcome to Small Talk Big Issues. Thank you for accepting.
Thank you. I'm so happy to be here. Can I tell you a funny little story about that digital health terminology?
Yeah.
Okay, so that was about in 2007 that I really, just by luck, sort of got into this ability to use behavioral science and technology. Truly by luck, I met somebody on an airplane. But then about 3 years later, one of my colleagues said, well, something about digital health. And I said, well, what's digital health? And he goes, well, it's what you're doing. And I go, I've never heard it called digital health. I was doing like health coaching online or something like that. So it really was quite funny. And then, this has just completely blown up. And so it's such an exciting time to be a behavioral scientist and to have the technology advances that we have. So yes, that's just a cute little aside. That was my good colleague, Josh Claypoe, who's very dear to me. I've worked with him for, about 30 years, Kevin. So,
wow.
Yeah.
Wow. Well,
yeah.
So you've been in this since the beginning, well before I was.
Yeah.
And I know that at Observia, we've had so many difficulties in the beginning and learning and failing and learning from failures and then getting some successes. So my first and most important question to you is, what are the key success factors in digital health interventions?
That's a really good question. And I can totally relate to you about failures, right? Because we're still learning. We have not gotten this totally dialed in. But I think there are a number of things that I think can really make a program successful. Now, the first one, Kevin, is going to sound a little bit odd when I say this. But again, it's from all these years of experience. Really, you have to think about being in the business of behavior, that is the business, and conceptually building a program up from that. Because what I see is people want to build a diabetes program or adherence program or a smoking cessation program, or weight loss program, whatever those changes may be, and they sort of lose the focus of, we are really in the business of changing behavior. And I think making that subtle shift or pivot, if you will, helps people really stay focused and build a behavioral change program to change some of these, behaviors that we know will improve health. So I hope that makes some sense, because I think fundamentally it's just absolutely essential.
So really starting with behavioral change objective and then adding the digital to it.
Well, it's a little bit different than that. And I know I have trouble articulating this. But it is that let's say, if you are building a digital behavioral change program, that you really conceptualize that you are changing behavior. Now, the behavior you're going to change might be exercise behavior. But again, I think fundamentally thinking and conceptualizing the work, that the work is about behavioral change. Now, if you're marketing the work that you're doing, of course, you're going to talk about, this is for diabetes, or this is for smoking, or whatever. But I think as the builder of the program, that it's really important to stay focused on, we are building a program to change behavior. And the behavior we're trying to change is this. Does that make sense?
Absolutely.
Okay, great.
So let me ask,
that's the most important. I really do.
Well, let me ask the opposite question. What shouldn't you do? What are the pitfalls that you've seen?
Oh my gosh. Well, there are probably more pitfalls I've seen than elements for success. Kind of carrying on with that thought I just had, sometimes when I work with clients, I have to remind people, keep your eye on the ball. And this happens, even in programs, you see this drift in terms of content, like drifting the content back toward a lot of information or telling patients what to do. And we know those things don't work. So it's keeping your team, as a behavioral scientist, focused truly on behavior change and not on those things that we assume work, like lots of information or, again, telling people what to do. So that's one pitfall. And then I have another thought, Kevin, and that is, it's really important not to mix scientific theories and models when you're building these programs, because there are a lot of really great theories and models of behavioral change. But I think it's important to pick one and stick to that, so that you're not mixing concepts. And I see that a lot, like throwing everything, everything, even the kitchen sink, at what we think or assume helps people change behavior. So it's really having a single model that you can build into a platform that's scalable. And then, so I have lots of pitfalls, Kevin. Another pitfall that just came into my mind, it's this idea that you really do need a behavioral scientist. And into your audience, this, of course, won't be any surprise. But I think you need someone who has designed behavioral change interventions, has empirically tested them, evaluated them, a subject matter expert, someone who can really help your team know the difference between fact and myths or assumptions about behavior change. And usually that requires an advanced degree, a person who really has studied academically the science of human behavior. And I think it really is helpful if you practice with real people. So you understand at a deep level, how do people really change their behavior? And then, if you're on track with actually hiring a behavioral scientist, and there are some awesome ones out there, don't bring them in midstream in your project. Bring them in at the beginning so that they can help you build that whole product from beginning to end. I have a number of clients, they're really thoughtful about needing a behavioral scientist, but they'll bring me in for a very limited role. It might be to train their health coaches, that's great. But it just makes such a difference if you are conceptualizing your digital health program from the very beginning using behavioral science, because you can layer all that behavioral science in. So I think those are probably some of the main pitfalls. I could probably come up with more.
But I'm absolutely agree with you on those. So and I'm sure you can come up with a lot of them with the experience that you have. And let me ask you another question, then, a more organizational question. And particularly as you know, at Observia, we work primarily outside the United States.
Yes.
You work primarily inside the United States. We have very different healthcare systems. Who do you think should be taking the lead in terms of providing behavioral change initiatives to patients? Should it be pharma? Should it be payers? Should it be clinicians? Who should really be taking the lead?
That's a complicated question. I'm sure that's why you're asking it. I'm not sure that I have the best answer. But my thoughts about that would be, this is simple. From a behavioral scientist perspective, who stands to have the most reward? You could think of it that way. So who has the most incentive, to use these digital programs? And all that list that you said, like insurance companies, large integrated healthcare systems, self-insured employers, even corporations come to mind. And Kevin, it's not always a financial reward or financial incentive. I've worked with large companies who simply want their employees to be well, even though they might be very skeptical about the return on investment. So it's not always financially driven, but could be mission driven. And you're right, it's complicated because everyone has sort of a different piece of the pie, if you will. So, and then most of the work right now, at least the work that I do in the United States, it's probably your experience too, it seems to be with these, call them startup technology companies. Some of them have been around for quite a while. But so what I see are these partnerships between these technology companies, building these digital behavioral change programs, and then, wanting to market that to one of these groups that you just mentioned or we just talked about. So that's how I see those things working together. But it's hard. I think there are lots of opportunities for collaboration and partnership, but you have to find, if you're working that way, again, what's the reward? What's the benefit to each part of that team?
Has it been your experience? One of the things I've been a little bit frustrated with, there's so many wonderful connected devices in the healthcare world. And I have the impression that many of them just kind of assume that if they provide lots of data back to the user, then the user is going to change their behavior. Do you see that kind of frustration, or are some of them starting to move into more guided behavioral change?
That has been a complaint for a long time because we are seeing all these technological advances. And I know I just read a paper probably last week about this very same thing. Well, it was a paper about, all these digital opportunities now to track, biometrics. And it's the same thought that I had 10 years ago. Yes, so what? Just because I can see what my heart rate or my blood pressure is all day, that really doesn't help me understand as a patient what I need to do about that, behaviorally, what I need to do to manage that. I may understand even, from an information standpoint, what's too high or what's too low or where I need to be. But if I'm not given the strategies that I need to make a difference in that metric, I can't really see the usefulness of it. I think we're going to keep moving forward where there is this integration. This is kind of obvious, but where these metrics could be fed back to the patient, and some feedback with behavioral suggestions about what to do differently to better manage this problem. I think that's where we're headed. But the idea that just giving people some feedback, I think, is a little bit weak.
Agreed. I often find that those who adapt their behavior on the basis of feedback are probably the people who need the support the least. In other words, the people who are ready.
Exactly. Just, think about steps. I had a Fitbit for a long time, and I was a person that was really motivated to get more and more steps and, to use that, to wear it. But think about all the behaviors you have to do. You have to get the Fitbit, and I'm not picking on Fitbit, but you have to get the device. You have to wear the device every day. You have to, look at the device. And so I think, again, we're getting more sophisticated with that, but you're exactly right. And this was another thing, just thinking about these digital programs. All patients and all people obviously are not the same. So when you're building these programs, you have to think about how will we, in the industry, we use the term segment. How will we sort of put these patients in different categories? And then when you do that, you have to be thinking about how will your intervention work in a tailored or more personalized way with each of these patients, right? And then as the patients are moving through your program, like from day 1 to day 30, hopefully their behavior is changing, and you have to change the way or modify your intervention or change the way that you're communicating with them based on the behavioral data that you're collecting. So I do feel like we're gonna, I'm just very excited about where things are headed from this digital perspective. And it's the first time ever in my life, that there's an opportunity to do behavioral science at scale. And it's so important because it's a resource that, people, like everyone, needs these programs, but there aren't enough humans in the world to do it. So to be able to deliver it digitally is just absolutely awesome.
Excellent. I have just one last question for you, Sherry.
Yeah.
Why did you get into this? Why did you get into behavioral science, digital health? What inspired you to do that?
Oh, Kevin, I have to think back so far. Okay. So do you know this quote? I'm going to tell you something you said inspired me. There's a quote by Isaac Newton, and it goes something like this. It says, "I see further because I stand on the shoulders of giants." And I love that quote. So my inspiration goes back hundreds of years, literally, right? But I've had an opportunity to work with such incredible people. Bill Miller, the father of motivational interviewing, was my clinical supervisor at the University of New Mexico. I worked with Jeff Fisher. Jeff and his brother developed the information, motivation, behavioral skills model, which has been very influential throughout my career and to this day. And I was also really inspired by the work of Ed Wagner. Again, these people are probably before your time, but he developed the chronic care model. And I read his work for many, many years and then had an opportunity to work with him at the World Health Organization, just briefly. But these are, in my mind, the giants that I stand upon their shoulders. And I've been, well, and if I may give you this other inspiration that will shock you if you know me very well, because I was actually inspired by a personality theorist by the name of Theodore Milan. He's a well-known American psychologist. He wrote a book in 1975, and get this, Kevin, it was called Medical Behavioral Science.
Really?
Yes. So I had an idea that I wanted to mix these two concepts, but didn't know how to do that. And this was way before Google, you couldn't just look it up on the internet. And so when I found that book with that title, I said, this is a pathway forward. Somebody is doing this, not only doing it, but researching it and writing about it. So I knew there was a pathway for health psychology and behavioral medicine. And that's what I pursued. That's what I did. And I've had such incredible opportunities, Kevin. You're just talking about inspiring, just makes me think about all the great colleagues that I've worked with and leaders in healthcare and fabulous organizations who, for the most part, really supported my efforts to integrate behavioral science into those organizations. And Kevin, thanks for asking that question, because I swear no one has ever asked me that before. It's fun to think about, Well,
yeah, thank you, Sherry. You've added to my reading list for one thing. I'm ashamed to say I had no idea there was a book written in 1975 on medical behavioral science. I will go out and find it. So
I can still see the cover of it, Kevin, because I pulled it off the bookshelf of one of my colleagues. I was doing some practicum work, and I pulled that thing off the shelf, and I was like, oh my gosh, you're kidding me. Now, remember, this was back in 75, so everything was quite focused on, like on personality factors and more, can I use like psychosomatic, but very different than.
Isn't that the tail end of the behavioralist world?
That's what I'm saying. It was very unlike me to be kind of hooked into this book. But like I said, I knew somebody was thinking about this. And I knew there was a journey ahead.
Well, Sherry, I know the communications that you do and the work that you're doing, and I'm sure that you've been inspiring a whole lot of other researchers and clinicians in this world as well. And thank you very much for participating in our little discussion here.
Kevin, it was absolutely my pleasure. Truly the highlight maybe of the whole pandemic.
Well, that's a kind of low bar, but thanks, Sherry.
You don't know what's going on around here. Yeah.
True enough. Yeah.